Hello, my name is Justina Powell. The clinical nursing problem that I identified was adolescent obesity. Adolescent obesity is a major health concern in the United States. It has both physical and psychological consequences, immediate and future health risks. It has been noted to be difficult to treat for this population and resistant to most traditional interventions. So it is very important to try to find effective interventions that will help treat and prevent adolescent obesity in this population. Healthy People 2020 called healthcare professionals to assist and reduce the proportion of children and adolescent populations that were obese to 16.1%. It has grown at alarming rates across the United States over the years. In 78 and 80, only 5% of our population was considered obese, whereas it grew to an alarming rate of 18.4% between 2009 and 2010. Since that time, we have made small impact in this population and the amount of obese adolescents that we have. In 2011 to 14, 17.4% were noted to be obese. So it is an area that definitely needs nursing's interventions and needs to be the most effective interventions. Studies that I reviewed show a positive correlation between family-based interventions and positive outcomes in the treatment and prevention of adolescent obesity. Many of these interventions that I reviewed use a multidisciplinary and multifactorial approach. They all include physical and psychological components. Since it does have significant consequences in both, it would not be effective to treat one without the other. And that has been shown over time that the traditional approaches do not completely address the adolescent obesity rates. Some of the studies that I reviewed talked about family functioning related to parent-youth relationship quality and how that relates to health-related behaviors. I based my project off of these randomized and non-randomized clinical trials, and I proposed a 12-month project in which the parent or guardian must commit to participate in with the adolescent, the obese adolescent. The project is a combination of physical and psychological interventions. Physical interventions include the nutritional counseling, physical activities, and that will occur 3 times a week. 1 hour per week will be allotted to nutritional counseling, to where we will review the food diary and the log that the participant keeps throughout the week to talk about healthier choices. The other session will be physical activity, and where the adolescent and the parent, they do physical activity sessions together, and it'll be tailored to their individual need. The psychological component is going to be led by the family checkup. That is a tool that is going to evaluate family functioning processes and to educate families on effective family management strategies that will help to support the adolescent for their success. So Van Ryzen and Nowicka found that when they used the family checkup in their clinical trial, they found that the adolescents and the families that had a greater parent-youth relationship quality therefore also had better health-related behaviors, such as eating attitudes, less depressive symptoms, and more physical activity, and those things were directly linked to obesity. So at the age of 22, they did find that the families that had a better parent-youth relationship quality had lower rates of obesity. So that's where my project basis came from, and the outcomes of my project is to use a family weight loss program involving physical and psychological interventions to treat adolescent obesity, to use the family checkup as a tool to demonstrate effective family functioning, such as communication, trust, acceptance, support, parental monitoring of healthy behaviors, to demonstrate that they can have an impact on health-related behaviors, such as eating attitudes, physical activity, and depressive symptoms, and those behaviors are directly linked to obesity. And then, of course, the other objective is to decrease BMI for age in the adolescents ages 13 to 18 of this project. The outcomes will be demonstrated by the survey that is given for family functioning. So the initial screening for the family functioning assessment will the adolescent will be giving a survey to take on family functioning and how their family functions in their perspective. And then as you progress, the facilitator will evaluate, provide assessments and feedback, how to change that structure to be positive and supportive of that adolescent. Then they'll also take another survey at the end of the project. Also, another outcome will be decrease in BMI for age will be demonstrated by a reduction in post-intervention data. That'll be tracked by BMI for age software. And adolescents with more positive parent-youth relationship quality will have a greater decrease in BMI for age post-intervention. Some of the biggest changes that I feel like this intervention can bring about is the family-based multifactorial approach to weight loss, including components related to nutrition, physical activity, and family functioning, will deliver the greatest results in the treatment of adolescent obesity. Also, effective family functioning is expected to facilitate the behavior change process by modifying parenting practices and reducing risk factors that are directly linked to obesity. So changing the way that we approach the interventions to treat in the treatment and prevention of adolescent obesity can greatly impact this population. Family-based behavior modifications and lifestyle changes are expected to have a significant impact on adolescent obesity. Less severe declines in relationship quality predicted higher levels of healthy behaviors and lower levels of maladaptive eating in Van Ryzen and Nowicka study. So I do feel like this project will show that adolescents with greater parent-youth relationship quality will have a greater reduction in BMI for age at the end of the project. Thank you so much.